Hi, my name is Dr. Erica Steele, and I am a naturopathic doctor and founder of Holistic Family Practice. Today, I wanted to speak about the value of the second and sometimes third opinion, or fourth or fifth or sixth, and why it's important to get other opinions. Believe it or not, doctors like myself, we are all human beings, and I don't really care what letters you have behind your name. It can be MD, ND, DO, FNP, it could be all kinds of things. LMNP, whatever, doesn't really matter. There's a lot of letters behind a lot of different people's names, and all that is a what we call a credential in an attainment of education or book knowledge that's gained. Where the real wisdom comes is practical expertise and practical understanding, right? And so that's why in a lot of cases we have clinicals, or we have practicals, or we have preceptorships where we study with different types of specialists and different types of specialties before we decide on ours, to be able to gain that understanding and education from a practical perspective, right? So there's the book knowledge, and then there's the practical education. And then once you get out, depending on what specialty you are, depends on what you learn, right? So initially I thought, I really want to go into autoimmunity. I really want to learn more about autoimmune conditions. And unfortunately, while I was learning that, I think she was like my first preceptor, who's somebody to learn from. I was a PhD in nutrition. And she was just an amazing mentor and Jewish mom to me. She was just so sweet. And unfortunately, before we were done together, she got breast cancer and passed away. And for me, I learned that, I probably wouldn't be able to emotionally handle working with people in that way, because I'm very empathetic and very understanding. And so connecting with people, I didn't want to have to shut a part of myself off in order to serve people. So I kind of looked at everything, and I decided family practice because I wanted to, work with little kid energy, because they're just so happy and fun and curious and alive, but then also get the super hard autoimmunity, stage 4, blah, 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 right? And then I get everything else in between. So I get a good span of digestive, hormonal, neurological, mental health, all kinds of different cases, all kinds of different perspectives, hormone conditions, you name it. I kind of see it all. And so family dynamic, family systems. So it's pretty cool it's a very dynamic form of practice. And so, we're all human beings, right? Having this human experience, we're exposed to what we're exposed to. We learn what we learn. And then we have to be open enough to be able to hear, not from the perspectives that we've learned from, right? We have to let go of that and really be open to the person that's right in front of us. And sometimes, if we haven't slept well, or we had a fight with our significant other the night before, or, we haven't drank enough water, or blood sugar's off, right? It's going to inhibit our ability to really be present, really be open for that person, right? And we're all human beings. We all have our own stuff. I remember, when I was first starting to treat, I had a lot of pride, I had a lot of ego, I had a lot of, anger that wasn't towards the patients. That was just my own internal anger that, they could feel and they could sense and they could pick up, right? And I'm not ashamed of that. I just know that was all a part of my journey, and that's all part of the process of my own healing and my own discovery. And now that I move into more of this kind of mastery, state, because I've been doing it a long time, I'm learning just all the complexities and all the nuances and all the things involved, right? And so working with the public can be a lot. And then working with people that are not well and want to be well, and depending on you to be well, that can be a lot too, right? And then balancing your own health in the midst of all of that, right, is a whole nother thing, right? And so, people get, burn out, they get fatigued, they get worn down, and it's really up to the provider to then say, you know what, I need to do some self-care. I need to, take care of myself better or whatnot, right? And that's why I'm always dedicated and committed to my own personal growth and health and development. So knowing that, right, understanding all perspectives and seeing that, right, but then also recognizing that you are in control of your health, meaning that you are empowered. Your health is your responsibility. So if you go to somebody, right, and you don't connect with them and you don't vibe with them, there's not everybody that vibes with me. Like I can be brutally honest with people. And some people, they want it a little bit softer, a little bit more gentler. And, I can be soft and gentle, but sometimes I have to take a stand for people's health and tell people things that they don't want to hear. So, that may not be your cup of tea, right? And so, there's even people that come in and they're like, I'm not, this chick, she's got her own thing, right? And they make up whatever story they want to make up about me, and that's fine, right? But the reality is that it's okay to say no. It's okay to walk away. It's okay to be like, you know what? I'm going to find a second opinion, a third opinion. If it doesn't resonate with you, if you don't feel good about it, if you don't feel supported, if you don't feel like you're being heard, if you don't feel like you're getting anywhere, you're getting the information you need. Our jobs as doctors are to be teachers. Doctor in Latin means teacher. Our job is to teach our patients, to serve them, right? And I take that very, very seriously. I know other providers that do, and I also know other providers that don't. And then there's different types of providers too. So understanding what perspective you're going to. I'm not going to go to an allopathic doctor looking for nutrition advice. I'm not going to go to an allopathic doctor or a medical doctor or anybody looking for supplement advice. They're not trained in that. They don't know that. That's not part of their education. If I, have a certain symptom and I want to get it checked out and make sure, rule out all the big stuff, that's why I go to an allopathic doctor, right? More of the subtle things and more of the health-related things, not the disease things, because disease is more allopathic driven. Health is more like a naturopath or, even a chiropractor from a spine perspective. Like chiropractors really are well on the spine and the nervous system and how that approaches things, right? So we all have our different perspectives, right? And acupuncture is going to look more at our energy, going to look at more of our, bioenergetic frequencies, our meridian system, and then balance the body that way. So everybody has a different perspective. And I think it's important to educate yourself on that provider's perspective before you even make, the conscious commitment to go to them, because otherwise you're going to frustrate yourself. I can't tell you how many people come in and they're like, my doctor didn't tell me about this supplement, or my doctor couldn't tell me about this, diet, or they couldn't give me an insight. And I have to let them know they're not trained in that. That's not their job. Their job is not to look at that. That's why I exist. That's why, I'm the type of doctor that I am, to look at those things, right? And that doesn't make me better or worse than them. It just makes me different. We're all different. I have incredible, endocrinologists that I love to send patients to. I have incredible cardiologists. I have incredible, internal medicine people, when I needed that perspective. So it's all about perspective. So that's really what the opinions are, is gaining that provider's perspective and respecting their opinion. And so, you don't have to agree with their opinion to respect it. So I think that's important to realize when you're searching in your journey for healing, that's a part of the process in discovery, is really connecting with, what you need and what provider's perspective you need. The internet is a vast place. It has a lot of information. Some information is accurate, some information is not, some information is old, some information is new, and healthcare is always rapidly changing. And healthcare providers are required to stay on top of the CEU, their continuing education, to stay ahead of the trends and the curves, because they're always changing with new research. The challenge with just kind of going online and searching and researching is, that there's a lot of information, and some of it may apply to you and some of it may not apply to you. And you don't have the benefit of diagnostics, and it takes years to understand the nuances in diagnostics, the nuances in laboratory. It takes a long time to really focus on those things. It's not something that just, you can Google something and figure it out. I think sometimes people don't understand the complexities behind, reading laboratory. And so it's a whole, world in and of itself, very amazing world, if you ask me. But, understanding that, it's very difficult to be the patient and the provider. Even myself, I have a naturopath that I see. I have other providers that I see. I have an acupuncturist and massage therapist. I have, mental health people I see, because I know for myself, I can't be objective in my own world. I can't always see my blind spots. So I need other professionals in my world, as part of my healthcare team to help me to see different perspectives. And that's really helpful. And so there is a value to having all those opinions and all that support around you to really encourage you, motivate you, and inspire you to live a healthy and a natural life. So I'm Dr. Steele. Hopefully that clears things up about opinions and perspectives and doctors. Thank you so much. Have a wonderful day.